Hello and welcome to this question and answer session, which is on physiotherapy in chronic respiratory infections. And this was a presentation given at the ERS Congress by Dr. Arietta Spinu, and she's from King's College London in the UK. She's a respiratory physiotherapist and a lecturer in cardiorespiratory physiotherapy. And first of all, we're going to see Arietta's presentation. She's done us a digest of the presentation that she gave. And then I'm also delighted to welcome Jeanette Rawlinson, and she's one of our expert patients from the UK. She's on the ELF Lung Cancer Patient Advisory Group and the ELF United Patient Advisory Group. So first of all, let's watch Dr. Spinu's presentation.
The aim of my presentation was to assess what we know about how useful the airway clearance techniques are in the long term. So I asked the question, can airway clearance techniques reduce how many times people get an exacerbation, what we know as flare-ups, reduce their need to stay in the hospital, or improve their quality of life compared to other treatments, or nothing or some treatment in chronic respiratory diseases? And for the purposes of the presentation, I talked about 3 respiratory conditions: chronic obstructive pulmonary disease, bronchiectasis, and cystic fibrosis. Airway clearance techniques are techniques and devices that we use alone or in combination to facilitate clearing our lungs, so to facilitate airway clearance and to generate a more effective cough. There is a long list of techniques and of devices that people can use. We have evidence that people from different countries show a preference in different techniques. For instance, you see in this map that for an acute exacerbation of chronic obstructive pulmonary disease, patients in Sweden use mainly positive expiratory pressure devices. In Australia, they use exercise. In the UK and New Zealand, they use active cycle of breathing techniques, and in Canada, they use manual techniques. The main reason for this could probably be that we have a better understanding about what happens during and after an airway clearance technique, but not what is the effect of this treatment in the long term. When we try to summarize well-conducted randomized trials for the effects of airway clearance in people with chronic obstructive pulmonary disease, we found only a few studies. 2 studies with only a few participants showed that performing airway clearance techniques during an acute exacerbation of chronic obstructive pulmonary disease did not reduce the number of exacerbations in the following 3 to 6 months. Also, they showed no difference in how often the people who participated in the study were getting into the hospital. Based on one study, people with chronic obstructive pulmonary disease who performed airway clearance when they were feeling well had less hospital admissions, although the number of days that the patients needed to stay in the hospital did not change. And they also needed less antibiotics. These results were based in one study. In patients who have bronchiectasis, a review found one study where airway clearance did not reduce the number of exacerbations in 3 months, but improved the quality of life of the participants. Later on, a well-conducted randomized controlled trial showed that patients who performed airway clearance had less exacerbations and a better quality of life in 1 year. In cystic fibrosis, there are many clinical trials and review studies. However, most studies compare different airway clearance techniques rather than a specific technique compared to nothing or a sham treatment. One review included 8 studies that assessed various airway clearance techniques and treatment plans, but none of them had long-term outcomes such as the number of exacerbations, hospitalizations, or the need of intravenous antibiotics. As you can see, our clinical recommendations base in low quality of evidence. This is not surprising, as studies that are conducted long-term are much more challenging for many reasons. However, the long-term effects of a treatment is probably what matters most. The findings for the short-term effects of airway clearance are promising, and this is one more reason for us to look into this kind of treatment much more carefully. In summary, we still have lots of questions about the use of airway clearance, particularly about the long-term effects of performing this type of treatment. We know that different airway clearance techniques are used in different chronic respiratory infections depending on the disease, the clinical phase of the disease, but also the country of the patient. We base our current clinical practice on our understanding about how lungs work and what happens during airway clearance techniques, and also a small number of evidence about the short-term benefits that these techniques provide. So research in this area is particularly important. I would like to thank you for listening and take this opportunity to invite you to participate in our research. If you have bronchiectasis or you look after someone who has this condition, please complete this survey to help us know more about your experiences and challenges of performing regular chest physiotherapy. Thank you.
Okay, I'd now like to pass on to Jeanette. Jeanette, would you like to ask Dr. Spinu the first question?
Yes, thank you. Really interesting presentation. Just wondering why there are such big differences between the countries regarding the airway clearance techniques that are chosen, and how does each country choose and justify its choice if there is so little proof of efficacy?
Thank you for the question. And there are lots of differences indeed between the countries, and we've seen that all over the world, that people tend to use various airway clearance techniques even for the same condition, and we have evidence about this. Now, there could be two main reasons, and they are related to the characteristics of the people or the characteristics of the healthcare system, I think. So when it comes to the characteristics of the people, it's about the prevalence of a specific disease and the causes of a disease within a specific area, the severity, and how much of an important component the sputum is of the mucus load is related to this specific condition. And also it's relevant to the culture that the patients have about the ownership of their disease management and how much they want to do things by themselves, or they want to follow the healthcare professionals in a more directive way. When it comes to the healthcare system, so the more general environment they receive their treatment from, this is related more to the training of the clinicians and the experience they have. We know, for example, that in different countries, you have respiratory specializations or not. You can have different training courses for specific airway clearance techniques, or some of the clinicians and they use mainly a specific device or technique compared to something that others are using in a different country. So it could be the experience and how comfortable the professional feels with the specific list of techniques they have for a specific condition. There's also a component about the cost and what the insurance covers, and this can influence what's the mainstream for the suggestions in terms of the treatment that the patient can get. So there's a lot of different components that influence the current picture worldwide. When it comes to the evidence, we have no universal agreement to what's most effective, and we have very little evidence about the long-term effectiveness of what we have available. The guidelines are usually based on the evidence. So as a result of these limited studies in the area, our guidelines are not really useful into suggesting what we should do or not. And this comes to the international level or in the country level as well. So when it comes to the clinic and when a clinician needs to suggest a specific technique or device, I think this is happening more in an individual level rather than following a guideline or following what happens in the country only. We need much more work in this area, and that's certainly something we should be looking into soon.
Thank you, that's really helpful. My second question is, I didn't see cough assist or intrapulmonary ventilation mentioned in your presentation. What are the points of view or studies done about these?
So first of all, I would like to clarify this was not an exhaustive list of all the available techniques and devices. And we do see lots of new devices coming up or different techniques, mainly devices though, that we need to assess. And we enrich this list constantly. When it comes to cough assist, which is formally called the mechanical insufflator exsufflator, then this is a device that we have for a few years now. And it's mainly used for patients with neuromuscular diseases or spinal cord injury. And there's also some studies about the critically ill patients. So most of the evidence we have about this device are related to the neuromuscular diseases and spinal cord injury. We don't see this device as much in the patients I was presenting earlier. So patients with COPD or bronchiectasis or cystic fibrosis, because the way this device works is slightly different, and it mainly simulates the maneuver of a cough. So with the patients who have chronic obstructive pulmonary disease or bronchiectasis or cystic fibrosis, we see that they have enough strength to produce a cough usually, but the main issue is with sputum itself. So there's no much use in trying to help their cough itself, but we need to help the secretion get higher to a specific point where they can actually clear that through coughing. When it comes to the intrapulmonary percussive ventilation, this is another device. I think it's more commonly used in other countries like Australia, and its use is mainly studied in the pediatric population or patients with cystic fibrosis and chronic obstructive pulmonary disease. And the reason I didn't look into this in the specific presentation is that we don't have a Cochrane review to see its effectiveness in the long term, because my main focus was how these airway clearance techniques and devices can be used to actually have a benefit in the long term for our patients.
That makes sense. Thank you very much. I'd imagine that the amount and level of training and follow-up that patients receive from their physical therapists regarding their airway clearance techniques would influence their efficacy. Have there been any studies related to this, or are there any specific guidelines and training for them?
Yes, training is something that could influence how the airway clearance techniques and the use of the devices is performed, and it is something important. It makes sense that it's something that we should look at. However, usually it's not really mentioned in the studies that we conduct or read about. We have more information about the technique, so standardization of the technique, but not as much about who is actually teaching this technique to the participants of the studies and what's their qualifications and training. When it comes to the follow-up, this is one part of the standardization, and we always have information in the protocol of the study about how long the patients are going to be followed up for, and if they're going to have any refresher about their training with their airway clearance technique. Now, there is a variability in the world, and there is also variability within the European Union. And there is an attempt to harmonize the practices of the respiratory physiotherapy, but it's quite difficult to achieve. We had recently the harmonization of the respiratory curriculum from the European indicated what kind of techniques and which concepts physiotherapists should know when they're working in the respiratory field. And this covered both the bachelor level and MSc level. So this was a first attempt. We still have no studies in what specifically they should know or what kind of experience a respiratory physiotherapist who is teaching airway clearance techniques should have. We have some evidence about the comparison between specialists and less experienced physiotherapists in other fields, not airway clearance specifically. And we know that within the different healthcare systems, also the position and the role of a physiotherapist can also vary. So I think this is something we are working a lot within the European Respiratory Society to address. And we try to make sure that we have at least some standardization and a benchmark where people should achieve at least this kind of level of training so they can make sure that they deliver a safe and efficient treatment to their patients.
Thank you. What are the plans to overcome the lack of evidence for the airway clearance techniques? Are there any studies planned, and if so, in what populations?
So, of course, the only answer to overcome this lack of evidence is to do more research and more studies in this area. And we know that there is limited funding in the airway clearance techniques. And we had a tutorial in the European Respiratory last year where we actually highlighted this great limitation about the airway clearance techniques. Whilst we know there's very promising results from small studies, and we should invest more in identifying what's more effective for our patients, we still have more studies conducted in areas where there are drugs and medications compared to the clearance techniques or self-management. So I think this is something that patients and organizations could help with and also understand what they have to influence the decisions in terms of which are the priorities, because we have results that indicate that these techniques could be actually beneficial for the populations we see. When it comes to the current clinical studies and the projects that are planned for the near future, we see from the published protocols that there are some clinical trials in the pipeline involving patients with cystic fibrosis, bronchiectasis, neuromuscular disease, or critically ill people. These studies are still quite small in terms of their sample size, and some of them still compare different techniques. So they try to assess the efficacy of one airway clearance technique compared to another one. We need to slightly bolder and take a leap of doing a very substantial study in this very specific population and start about how we can work in a reconducted study for this field.
As telemedicine becomes more common in use, remote consultations with physiotherapists might help some patients to make sure their airway clearance techniques are the best they can be. Are there any plans for this and any plans for studies to see how effective such services might be?
So yes, telemedicine has an increased interest, and we started with web pages for the management of specific respiratory diseases, and I know a few which have been really successful in the UK and Australia. And I think that with the coronavirus nowadays, we see a rapid shift towards telemedicine and virtual assessments and virtual consultation. And the resources and the current restrictions, they actually force all the clinicians to start thinking about this way of work patients. Clinically, we see that there is a focus in the pulmonary rehabilitation because these are services that are more established throughout Europe and they are already running. So it's a matter of how they're going to continue to provide this service in the patients. But there's also the clinics that need to run, and they involve the airway clearance techniques. So what I anticipate in this area is that we will see more audits to start with, So we're going to see clinicians who have changed the way they've been running their clinic, and they're going to present their findings in terms of how well this worked and what were advantages and limitations of this virtual condition. And when we have this dissemination within the conferences, I think then we are going to have a better starting point to actually study how well this can run and if this is preferable compared to face-to-face consultations and so on. So I think there's lots of movement in this area, and especially because of the coronavirus at the moment.
Yeah, thank you. I mean, I'm going to speak personally now, but I've also had a telephone conversation with a respiratory physiotherapist during this lockdown or lack of face-to-face clinics, and we converted it to a video call, and actually it was extremely useful because she could see how I sit in my working day and how I'm breathing. So obviously I didn't have the travel of getting to a clinic, because I asked her, she would normally see me walking upstairs or across a ward to see how my lung function is, etc. So it worked reasonably well. My concern really around telemedicine is those people who are not comfortable with it and less familiar or have less access. So I guess I hope that the outcome of any studies during this and follow up will actually ensure that we don't increase health inequalities or discrimination about those less able to use telemedicine.
Yeah, that's a really important point. And I think actually I have the impression that what's going to happen is we are going to have some sort of virtual consultations alongside the face-to-face for those who cannot attend, or have some kind of alternative, because we know that not all patients have access to computers or internet, or even the preference could be different, so they might not be willing to use this kind of techniques or find it in person. So we need to have a way to reach those and still provide treatment. So I think we are not going to completely shift into the pure remote environment, but still my impression is that we're going to have some services or part of the services running this way if clinicians and patients believe that it works.
Yeah, thanks. That's really reassuring. Ensuring and measuring patient compliance with airway clearance techniques can always be difficult, like any other process. Are there any partnerships with technology companies to plan to address these issues? Digital enhancement or gamification of the sessions? And then is there the ability to create virtual airway clearance technique sessions with other patients as a form of buddying up or camaraderie and encouragement amongst the patients?
Yes, so this is a very good question, because adherence and compliance in the airway clearance techniques is very important, because obviously if you're not doing something, there's no way it's going to work. And this is also a limitation sometimes even in the studies, that we don't know actually objectively how much of the time the patients have spent into this kind of treatment. One way around this is to use the technology, and it's much easier to adapt a positive expressor mask and use a meter to see how often this is used consistently compared to using techniques. You would go a questionnaire or some kind of for the patients to record the treatment. And we know that patients automate the time they spend their airway clearance techniques using the devices. So to measure that objective is very important. We have studies with antibiotics that used a recording of the time that the participants spent using the nebulizer. And we know that we use a type of recording for airway devices. A really useful way to see if the airway clearance techniques are indeed performed as they are instructed in the protocol, for example, if they're effective or not. When it comes to what we call the serious gaming, there are also new studies in this direction. And we know, for example, that there is a study and a between university and Microsoft to develop a game for children with cystic fibrosis. And there's a lot of work that is actually using these games even in adults to motivate patients in the same spend doing their airway clearance and use this game part of the management. So with the last part question about the virtual groups of airway clearance techniques, I think this is an innovative way of thinking about how to perform the techniques and motivate people to follow the treatment, find an enjoyable way to continue doing that. At the moment, I don't think this is happening clinically or in a research study. It is part of pulmonary rehabilitation when it comes to education, because one of the sessions that pulmonary rehabilitation has is usually airway clearance techniques. And at the moment, some of the services run virtually. So I guess this is a time where we can test how well this can work. But it's definitely something we should be looking into as we move into more virtual environment in these days. And I think it could help people to understand works and also create communities where they can get support and they can ask questions their peers. And I think it's a good idea.
There's a lot of patient support groups, whether that's lung cancer, Breathe Easy groups by the British Lung Foundation that take place in and around hospitals and the community. And of course, they've all had to stop. And that moral support for people amongst one another, irrespective of the lung condition, the breathlessness or the techniques might be common. And I think for many people, that might be a welcome addition, irrespective of whether the efficacy of the study is there. I think it would improve quality of life for the patients in terms of their mental health, as well as improving the airway clearance techniques and other pulmonary improvement.
Yeah, absolutely. And I think there is a very powerful element in this shared experience that patients can have, and it's something we cannot offer as clinicians. So we should encourage this kind of settings and try to create these communities more and more, because it is something, especially for long-term respiratory conditions that you live with, and having this support from people who have the same experience with you.
Yeah, really important. Thank you ever so much for answering the question. Thank you.
Just like to say thank you very much both to Jeanette and Dr. Spinu for attending today for a really useful discussion. Thank you.